Hey everybody, welcome. We are here again with what's new and coming up with lipedema. I'm Leslyn Keith with the Lipedema Project, here with my friends and colleagues, Catherine Sayo and Siobhan Huggins.
Hi everyone.
Great to be here together. Gail is, I think, off doing choir stuff. Is that what it is? Yes?
Well, it's also her birthday.
Oh, okay.
Month. And as far as I know, she was celebrating the entire month.
Okay. That sounds good. That sounds like a good way to do it. So we are here every Friday at this time, 4:30 p.m. Eastern. And we just like to say what is coming up, what exciting things have happened. And so we have a couple of things to talk to people about. But if you're here and you're listening live, and I know that Sandra is already here and Terry's here, but please put something in the comments. We just like to know you're here and you're listening. You know, I always like to talk about the weather. It's kind of a weird thing with me, but whatever you want to talk about, because we have some things that we want to share with you, but we want to be able to answer your questions and comments and stuff like that and have this be a conversation. I think the first thing that we wanted to make sure that we did was to talk about our spectacular virtual heart-to-heart event conferences coming up on September 27, 28, 29. Unfortunately, the super early bird has ended, but we still have the early bird special it's now 147 for 3 days of jam-packed. I mean, it's going to be so much stuff happening there. Siobhan, talk a little bit about what's happening at the Heart to Heart.
Yeah, so twice a year we have an event, and this is our fall event, which focuses on the overall holistic approach. So with that, we're going to be talking about the mental and emotional, the psychological, the social, spiritual, physical. So kind of going over what is recommended for people with lipedema to get the most out of their care, because we're not just legs. We're not a pair of legs or a pair of arms walking around. We do have entire lives. There's a lot that goes into lipedema in terms of how it may impact romantic relationships, how you interact with doctors or other healthcare providers, how you interact with peers. It may impact mobility, and that may impact mental health. So there's so much that goes into it, and you can't just focus on the symptoms. There's a lot more that goes into it, and we want to talk about the approach, because sometimes like people can go from, there's nothing you can do about it, which was kind of the old paradigm, to, oh my goodness, there's like dozens of different things that I can do. How do I start? Like, how do I pick what to focus on? So part of it is introducing the holistic approach, but also, talking about how do you prioritize? How do you pick what you're going to focus on that day, that week, that month? How do you set up goals? How do you decide what's important to you? So like, that's what we're going to be talking about. And we have a lot of really great speakers. And yeah, who are you looking forward to most, Leslyn?
And Marcia says it's so worth it, so much information and fellowship with others. And I think that's the big thing about our events. It's interactive. As much as you wish to be, you are interacting with everybody else who's there. And I know, Catherine, you are going to be highlighting something at this event, talking about actually the surgical option, which is one of as Siobhan says, a plethora of options for lipedema. But Catherine, can you talk about that, how we're starting to talk about surgery is an option for some people?
Yeah. Leslyn reminded me last time that our Friday afternoons are not the time to tell the entire history and story of everything. So I will keep it short. We started, Lipedema Simplified, which was me making the documentary film way back when, looking at surgery as the magic bullet, that it was going to be the answer, that there was going to be liposuction and magically you step off the table and you're better. And I have to say that that's not what happened. Now, that being not what happened, in my very biased way, and it is biased, I had a tough time, and I thought, well, I guess surgery isn't the answer. But it propelled me and us to explore alternatives, which is all the conservative care. I don't regret that. But somewhere along the line, and listening to so many different people, I realized that surgery has its place and can be a very good, sustainable option for someone's protocol. So, on that note, Michelle Jacqua, who is a nurse navigator and case manager and works within the healthcare system. She does a lot of work with lipedema ladies. She came and she did a webinar with me last week and is going to do another one on September 15th. And we have, surprise, surprise, one of the top European surgeons coming to do a webinar on September 5th. You'll get more information. It's the free webinar. There it is, free webinar. The September 5th is not yet up there. The 15th is up there. So sign up for that one. We'll notify you. But it's so fascinating because, like everything, time and experience inform. And over the past number of years, different techniques have emerged, different, it's still liposuction, but each surgeon can bring a little bit of his or her own way of doing things.
And they've now added so much with pre and post surgery that it's really making this a more, it's improving the outcomes. I think there was issues before, but there's fewer issues now when you talk about doing that. Well, our holistic approach before and after surgery.
Yes, and that's the other thing. There, when we first started, there was this, I don't know, it could have been a hope, it could have been a dream, it could have been part of the whole idea of, magical, that surgery would be magical, that, at post-surgery, things disappeared. Well, that's just not the case. That even with the best surgeon, even with really good outcomes, you still need to continue diet and exercise and different support structures for your body, which is the conservative care that we do so much of. So there it is. I wish there was a magic bullet. I still am looking.
Well, we wanted to share with people that when it comes to our virtual event conference that's going to be 27, 28, 29 September, that's going to be part of the options that are going to be presented and discussed is going to be surgery, but also all the other things that you can do as well. Especially, you may or may not be eligible or appropriate or have coverage for surgery. And so we want people to know that that is one thing that's there that can be very useful, but there's so many other things too, and not to ignore any of those. So we want to make sure everything is on the table. We're talking about it all. And so sign up now, take advantage of that early bird special before that goes away too. And this is an incredible deal. It's $147 for 3 solid days of incredible information. Anything else you want to share about the event, Siobhan, before we go on to other things we want to talk about today?
Yeah, just highlighting the aspect of being able to interact with other people with lipedema. And because a lot of the really great stuff that I've learned actually came from some of those breakout sessions and my interactions with people during the event who weren't speakers. They were just other attendees, but they were sharing their experience with compression and other conservative care, just jumping in, picking something that sounds easy that I can do. And that was really helpful for me, not only early in, But as the years continue on, revisiting and putting that question back on the table in terms of what's the next thing that I can focus on? Because there's always something, and there's always room for improvement, and that's been helpful for me.
I had something really lovely happen this week. I have MLD on Thursday mornings. So, and because I moved and lots of other things, my schedule had been really changed. But I went back to Megan here in Massachusetts on Thursday this week. And as I was going in, I noticed someone and I thought, gee, she looks so familiar. She looks like someone who came to our webinars, you know? And so anyway, I went in, had my session, and after the session was in the ladies' room, and she walked in, and then we were like, "Oh, hi!" And she was someone. Megan's practice has more than one therapist, so she was with the other therapist while I was with Megan. So we were chatting, and it's like, there's this connectivity or familiarity when you've been with someone, even in some of our webinars, and somehow we have a shared experience.
Yes.
That is wonderful. Anyway, I invited her down here. I invited her to my new place, which still has boxes. But anyway, I figured in 2 weeks it should be better. So I invited her to come and have a cup of tea with me on the deck.
Wonderful.
But I would also like to point out that this, our event in the end of September is also for the healthcare provider, for the certified lipedema therapist, for anybody who's working with people who have lipedema. Because if you are, you feel like you don't have enough tools in your toolbox to really help your patients, you're going to want to be here at this conference. And so when we look at all of the attendees that will be there, this is going to be everybody. I mean, you're going to be talking with expert speakers, but also healthcare providers who are trying to learn more, along with patients who have decades of experience with the condition. So to get all these people together is going to be exceptional. So check out that link below and sign up today. We need you there. We need you to be part of this solution. So we hope to see you there.
Oh my goodness, let me put the link in the chat. I didn't put the link in the chat.
And I just see that Marcia has said that she invited her primary care doctor and MLD therapist. That's just exactly who we need there, Marcia. So thank you for doing that. Get the word out to your team of healthcare providers, and let them know that they can learn a lot and they can do it from their home. They don't have to go anywhere. So we hope to have you all there.
And here's the link.
Yes.
To sign up.
Yeah. So, and we already talked a little bit about our the 2 free webinars we have coming up on the 5th and the 15th of September. They're both going to be talking about that surgical option. So be sure and check those out to learn more of that. And then that, of course, will also be discussed during the weekend of our event. But next, we wanted to switch gears because Siobhan just went to a wonderful conference last weekend in San Diego, California, and just had a lot happened around lipedema there.
Yeah, weirdly enough.
Yes. And so can you give us a little update from San Diego, Siobhan?
Yeah, so I haven't watched many of the presentations because the reason I was there was my company had a booth, so we were a vendor there. So I was mostly hanging out there, but that resulted in a lot of really great conversations with people who recognized me from the lipedema space and came up to chat. Some of them actually had lipedema, so we talked about things like carb cravings and why they were kind of struggling a little bit more with them, and them noticing that sugar increased their pain and swelling, and how difficult sometimes it can be with lipedema to go to these conferences and be sitting for hours at a time, and how that can cause leg swelling. So we were talking about like rolling your ankles around, just getting a little bit of movement with the calf pumping while sitting. But then at the end, every time at the Symposium of Metabolic Health San Diego, they have this panel of a bunch of speakers who were there, and someone from the audience came up and asked, what is the best treatment for lipedema? And I was not a speaker at the event. I have spoken at a different conference run by the same people before, but this time I was just there on business. But I happened to be in the audience because my friend and colleague Dave was giving a presentation. And so I was already there, and someone from the panel said, I think we should have Siobhan come up and answer this question, because she was familiar with my work. So I did end up going up on stage and talking a little bit about the holistic approach and the role that ketogenic diets have in lipedema care, some different physical methods of conservative care, and then, of course, recommending them to come check out the Lipedema Project if they have any questions or need any resources. So there was, for a non-lipedema event,
you were almost a speaker at the event. You were like an improv speaker.
a guest for one single question, and then I quickly made my way off back into the audience. So it was quite funny. But yeah,
we just hope that the organizers see that interest is there, and that that will be something that's on the schedule for the next event. That would be wonderful.
Yeah, and if I'm ever at an event, whether it's about lipedema or just low carb or anything in general, if you see me, come up and say hi, because I'm always happy to chat. Some people got quite an earful because they were asking, what have you been thinking about lately in terms of the research? It's like, oh boy, let me talk for a little while on this, but it was a lot of fun.
Yeah. So since we do have a little bit of time, I would like to bring up Terry's question. Terry was so good to have posted her question even before we started today. And so I'm so glad we have some time, and we'd like to talk about this. And she says, I'm desperate to know if there is a correlation to lipedema and gout, high uric acid. Siobhan and I talked a little bit before we went on air about this, and I have not seen anything say that there is a correlation between lipedema and gout, but and even on the list of high frequency comorbidities, other conditions that people with lipedema tend to have, for instance, like hypothyroidism, Ehlers-Danlos syndrome, that I haven't seen gout on that list. But Siobhan seems to think that there might be a correlation in another way. Can you talk about what we're thinking, Siobhan?
Yeah, so one thing that we do know is that there is a large overlap of people who have both lipedema and obesity, and with the vast majority of cases of abdominal obesity, it also tends to pair with metabolic syndrome. And that is one thing that can increase uric acid levels, because uric acid, not many people know this, can act as an antioxidant. So if you're in a situation where you have higher oxidative stress, like metabolic syndrome and insulin resistance, then you may have higher uric acid levels because of that. So there is more discussion nowadays, I would say, of uric acid being problematic in itself, but it may actually be another one of those markers where it's correlating with things like gout, because for one, the handling of it may be deranged with metabolic syndrome, but also because things that cause gout may also cause higher uric acid. And there's additional evidence for that in terms of another thing that can increase uric acid levels is actually starting on a ketogenic diet, because ketones and uric acid both compete with each other for excretion. But there's a really, really good paper and presentation on it by Amber O'Hearn, who talks about the potential advantages of uric acid in terms of humans. The presentation, I believe, is called The Case Against Uricase, I think. But just look up Amber O'Hearn and uric acid, and you should be able to find it. But the main thing is, if someone does have gout, that is the first place that I would look is, do they have elevated insulin levels? Are they experiencing higher inflammation levels? And are there potentially nutritional therapies that can be used to kind of resolve that and then eventually resolve the gout as well?
Mm-hmm. Yeah. Thank you for that. And then can we put Anna's comment up? Yes, she says, do symptoms of lipedema ever get confused with the symptoms of PCOS? That's polycystic ovarian syndrome. I got treated for PCOS for years, but I never had ovarian cysts, and my hormones were always normal. That's interesting. And there's a lot of with metabolic syndrome in PCOS as well.
Yes.
Definitely using, Eric Westman did a small pilot study that showed that using carbohydrate restriction worked very, very well for PCOS. And this may also, and I've seen it mentioned in papers, that there seems to be probably not as high as hypothyroidism and Ehlers-Danlos, but there seems to be an incidence, a rather frequent incidence of PCOS with lipedema.
Mm-hmm.
I have not heard of the two conditions being confused with each other, but just like gout and metabolic syndrome and all these other things, that there seems to be an association. What are your comments on this?
Yeah, I'd be curious what symptoms were being confused between the two, because typically with lipedema, we're looking at disproportionate fat distribution, painful fat potentially in the legs or the arms, depending on where is impacted, swelling, orthostatic edema, things like that. And with PCOS, it's mostly, as far as I'm aware, related to like irregular cycles, particularly painful menstrual cramping, potentially infertility, things like that. So I haven't heard of them being confused, but like you said, I wouldn't be surprised if there is PCOS going on with lipedema that can happen. And potentially you could have metabolic issues that are causing similar symptoms to PCOS, but not to the point of having actually polycystic ovaries. But yeah, I think it's an interesting question.
You definitely have weight gain with PCOS.
Mm-hmm. Yeah.
It's just not necessarily only weight gain to the lower body and to your arms, as it is with lipedema. I would just be impressed that if any physician who knew PCOS also knew about lipedema. But thank you for that question, Anna. It's a good question. And then there is a lot of comments in here. We also have Pat, who says, I'm wondering if any of you have heard of the cholesterol lowering siRNA shot affects lipedema. And I think whenever you have to take any medication, you want to carefully discuss with your physician what are the potential impacts on other conditions you may have. And lipedema is, a chronic condition. So it's worth saying, okay, this particular medication is going to be good for whatever, my heart condition or whatever that is. It also, what would be the impacts that it would have on my lipedema? I'm not familiar with that particular medication, so I can't really say that I've heard, the particular impacts that it has on lipedema. But it just brings up that overall question of, anytime you're prescribed a medicine, you don't want to just take it blindly. You want to discuss it with your healthcare providers and maybe make sure that they know all the other medications that you're on and they know all the other conditions that you have. Sometimes our healthcare providers kind of get caught in a silo, and you're seeing an endocrinologist and they're only dealing with your hypothyroidism or your osteoporosis or something like that. And they don't seem to be thinking also of you as a whole person, and you have other things going on. So it needs to be just discussed. Any thoughts on that?
Yeah, I think since not every doctor may be aware of the different domains that lipedema may revolve around, just saying Could this have any impact on connective tissue, on lymphatics, on swelling, if they're not sure what may be evidence of lymphatic issues, on fat gain or weight regulation, on metabolic health? And the answer may be, we don't know. Or we can keep an eye on it, do a trial run and see if you have any exacerbation in symptoms or anything like that. Because in all likelihood, there's probably not a trial available looking at a specific medication and the impacts on lipedema. You can always ask the community, has anybody tried this? Did you notice anything? It's going to be anecdotal, but it may at least give you some sort of idea of questions you can ask or monitoring that you may want.
Yes. Yeah. Excellent points. Excellent points. Thank you guys for doing that. And my neighbor, Julie, is here today. She's here at, just lives about 15 miles from me. So nice to have you here, Julie. And here, and Catherine's back. Okay.
I fell asleep.
I know.
Our soothing voices lulled you to sleep.
Had a rough week. So
Yes.
No, and it's also, I have a comorbidity that I've been dealing with sleep. And
Yes.
so just to let you know that, we all go through a lot of what we talk about.
yes.
Mm-hmm. Yeah.
Yeah. But that is going to wrap us up for today. It is wonderful being with everybody as usual every Friday at 4:30 Eastern. We love hanging out with you guys. Thank you so much, everybody who put things in the chat. It's wonderful to be here, and we'll see you next Friday.
Yeah,
Bye,
see ya.
everybody.